I'm Dr. Laura Schafer, and I'm a new physician at Lifestages Center for Women. I was born and raised in New Jersey. I went to undergraduate school at Lehigh University in Pennsylvania. I wasn't sure that I wanted to be a physician, so I decided to get my master's in public health from Rutgers University in New Jersey. Maybe I could do something in administrative position, but ultimately I realized I did want to be in clinical medicine, so I went to medical school at Lake Erie College of Osteopathic Medicine in Bradenton, Florida, and then moved to Columbus, Ohio to do my OBGYN residency. So I did my residency in Columbus, Ohio, and I actually really enjoyed the Midwest, so I wanted to stay in this area, and I also wanted to give back to Ohio because they did train me for residency, so I wanted to help take care of the people of Ohio. And I really connected with a lot of the physicians in the practice. When I interviewed, I thought they had a depth of experience and knowledge that they could pass on to me as a new physician, and both surgically and in the office. So I was happy to join this group and Premier. I am very into fitness, so I just joined Orange Theory, so I'm really excited about doing that and meeting new people through that, and it's kind of a competitive, fun fitness atmosphere. I love doing things outdoors, hiking, biking, so I'm excited to check out all the metro parks in the area. I'm learning to cook. I never really mastered that in medical school, but I'm getting tired of eating hospital food. I became a doctor because when I was in high school, I actually was an EMTB, and I loved clinical medicine. I loved taking care of patients. I loved interacting with patients, and I continued to be an EMT throughout college, and I pursued pre-med in college and then went on to go to med school. Well, initially, when I went into medical school, I thought I was going to be an emergency room physician because of my experience as an EMT. You know, it was high adrenaline, lots of high acuity, interacting with patients. But actually, when I went to medical school and did my clinical rotations, I didn't like my ER rotation at all because there was no continuity of care there. You just kind of saw the patients, they were in and out. And when I went to my OB rotation, I realized that you could have the continuity of care that I was looking for, but you could also have kind of those like high acuity type of situations as well, either with obstetrical patients or GYN surgery. Now that I am an attending physician, I get more continuity with GYN patients and OB patients. When I was in residency, we would kind of just see patients one day and then might never see them again. And so now that I've started here at Lifestages, I've been able to see patients more consistently and develop that type of relationship, whether I'm starting them through their pregnancy journey or whether taking care of them for their annual well woman care. I just like taking care of patients from all facets of life. So whether they're a young teen, just venturing into womanhood, or whether they're just pregnant for the first time, going through that journey with them, or even when they are kind of past their reproductive age and menopause. And I like taking patients through all of those facets of life and being with them through the good times and the bad times. I think Lifestages Center for Women is unique in the fact that we have a lot of diverse physicians that can offer a lot of various specialties, and that is with Dr. Rush and Dr. Metz, who do a lot of urogynecology procedures. We also work with midwives and have the Centering for Women program. I am the only osteopathic physician in my practice, so the philosophy that DOs were taught in medical school is that the person you treat as a whole unit of body, spirit, and mind. So I like to use that philosophy when I take care of women, not only taking care of their medical ailments, but also really focusing on what's going on with them emotionally and spiritually, because they are all encompassed in healthcare, and all those things need to be in place for a woman to be healthy and happy. I think we offer a lot of diverse practitioners, ranging from midwives to physicians who have vast experience and training and come from all different walks of life, that I think when a patient comes to Lifestages, they would find a provider that would suit their needs.